Welcome to another edition of Lasing is Amazing. Today we're going to talk about laser frenectomy. My name is Dr. Glenn Van Ass. In this particular instance, we have an 8-year-old who has a very thick frenum attachment with blanching when pulling, and you can see at higher magnification here under the operating microscope where the frenum is aberrant and pulling close to the tissue. We're using an MZ5 tip at 3 to 3.5 watts, 50 hertz. I'm using a little bit more water than ordinarily here. We're using the laser in H mode, and usually I'll use the laser at 5 to 10% water. In this case, we're using it 30% water, 20% air. We begin our incision right where the frenum attaches to the attached tissue. One of the problems with using a little bit more water is you have a tendency to get a little bit more bleeding. It takes a little longer as the water cools the tissue. Early on, you can see the laser is parallel to the long axis of the teeth. And once we open up the frenectomy, you'll see that it has a diamond shape. We'll start to cut closer and closer, angling back towards the periosteum. Often the adjustments are at first and third base. With erbium lasers, you can get bleeding, and if there is bleeding, you can do a laser band-aid using the same MZ5 tip. Turn the water off, 0.5 watts and 75 hertz. You're using 10 to of S mode will help with coagulation. Now the coagulation in hemostasis is not as good as if you use a diode laser, but it is enough to be able to get a clot and to dry things out when using this particular longer pulse duration. You can see the immediate postoperative result, and then you can see 2-week healing where the attachment now is higher up, and you can see when pulling there's a slight scar that will gradually heal over the first 2 to 4 months. I want to thank Biolase for their efforts in supporting lasers in dentistry. I'm Dr. Glenn Van Ass telling you to keep lasing. It's amazing.